India is now a key driver in the global surge of coronavirus cases. In less than a week, the country has recorded 1.5 million cases. And today, more grim news. Nearly 300,000 new infections and some 2,000 deaths reported, making it India's highest rise in infections and deaths in a single day. Things are so bad in some places that hospitals are running low on beds and on oxygen. Earlier, a local official in Western India said at least 22 COVID patients on ventilator support died while waiting for oxygen supplies that had been lost in an accident. Chandrika Bahadur chairs the Lancet Commission on COVID-19 India Task Force. She's joining us from Gurgaon outside of Delhi. And with the greatest respect, what on earth is going on?
Becky, first, thank you for having me. We're going through pretty much the worst possible phase of the pandemic here. It has been bad for a couple of weeks, but now it's reached a peak. And essentially what's happened right now is that the health system is just not able to keep pace with the sheer number of cases that are coming in. And that's what we're seeing. The story that you quoted coming out of Nashik is exactly that example of where the health system is getting overwhelmed with patients. Patients are having to share beds. They're having to wait for hours for admissions in hospitals. And it is truly a tragic crisis right now.
Well, let's drill down on this a bit. What is causing these really high numbers? Is the so-called Indian variant to blame here, or partly to blame here?
Possibly, but we don't exactly know. We don't have the data on the genome sequencing right now that can confirm that. What we do know is that we went through a lull in January, in late December, January, and early February, where numbers dropped very dramatically. The number of new cases dropped dramatically. And I think what that did was to instill a sense of false security in everybody, that we were past, the worst was behind us. And what ended up happening was that a lot of the COVID-safe behaviors that had been in play for most of 2020 essentially went down. And so people were out and about much more, mask wearing declined significantly, a lot of large activities, large gatherings were scheduled. And so the country behaved as if the worst was over. And we in the task force had a series of meetings in January and February where this was discussed. And there was a lot of nervousness around the fact that this could be a trough, a dip, but not the end of the pandemic. And unfortunately, that's exactly what happened.
So this was avoidable. Is that what you're telling me?
I think it was avoidable in the sense that if we had kept our guard and if we had been more careful as a country, as a people, these numbers would probably have been much less. Now, what we don't know is the effect of the variants. So it could be that with all of the safe behaviors, we would still have had a surge. But it is definitely true that if mask wearing, if distancing, if all of these practices had been followed, probably we would see a different set of numbers today.
New Delhi has just entered a week-long lockdown that could extend for longer. You say that there was a lot of nervousness. You now understand people dropped their guard. This could have been avoidable. So are the sort of restrictions that are going into place now enough, do you believe?
They're essential at this point, unfortunately. One of the challenges of not being careful early on is that then there are fewer and fewer options left in terms of what to do to break the chain of transmission. So in our report, we have basically recommended three different sets of options. And the first is, how do you break the chain of transmission? And one of those mechanisms is actually restricting activity. Now, it's a dangerous policy option because lockdowns that are severe and long-lasting hurt the economy, they hurt the poor. And so our recommendation very much was to limit and localize these lockdowns based on the surges in those areas. But that is exactly what you're seeing unfolding in Delhi. This is being done with a great amount of reluctance. I don't think there is any political leader in the country that really wants to impose lockdowns. But at this stage, this step has to be taken to reduce the number of new cases. The other thing that has to happen is a much, much greater emphasis on mask wearing and distancing, and a complete ban on large events and large gatherings. And this is also something which is kicking in now, but it wasn't in place for the last month. And we've really seen the effects of that play out. Our second set of recommendations was really around strengthening the health system. And unfortunately, this is not something that can be done overnight. And so this is, again, with the surge, we're seeing the edges and the limits of the health system in terms of the availability of doctors and nurses and paramedical staff, ambulance services, ambulance drivers. Everything is in short supply. So this is something that has to be resolved on an emergency basis, but it will take a few weeks. None of these issues around the lack of oxygen, the lack of medicines, none of that is resolvable overnight once numbers hit these levels.
Is the healthcare system collapsing at this point?
It's under severe strain in several parts of the country. And this would be, India's health system is notoriously underfunded. We know that. We have the public spending on health is around 1.5% of GDP. Total spending is about 3.6% of GDP. So these are low numbers by any standards. So in a sense, what the pandemic is doing is showing us and throwing a spotlight on what happens when there is a chronic long-term underinvestment in the health sector. So yes, it is under enormous strain. If the numbers go down over the next few days, then we will get a little bit of a respite, but that remains to be seen.
What can you tell us about this new so-called Indian variant, and just how concerning is it?
As I said, Becky, it's a little hard to know right now what the exact effect of this double mutant variant is going to be. We are beginning to start measuring, where it's showing up and how it's showing up. But it's too early right now to really say whether this is driving infections. Now, what we do know from the data that is coming in is that this time there is a lot more, and this is anecdotal evidence, a lot more infections within households. So it definitely, there seems to be a greater level of infectiousness, so that, even if one person in a household is infected, very quickly the entire family is getting infected, which wasn't the case in the first wave. So there does seem to be some difference here, but as I said, it's too soon to tell, and we have not yet done enough genome sequencing in the country to be really to be able to track the variant and to be able to predict the extent to which it is affecting transmission rates right now.
You talked earlier about the importance of restricting public gatherings. Prime Minister Modi's ruling political party has said that it would hold, quote, small public gatherings with a cap of 500 people. This is election season, of course. That doesn't sound like a small number to me, and that is after tens of thousands of people were seen at rallies organised by Modi's party. Quite frankly, isn't this reckless, given what is going on at the moment?
I suspect these numbers are going to drop just voluntarily. And, the 500 number seems very large, but as you said, it's a much smaller proportion of the tens of thousands that we were seeing earlier. My sense is that now there is a sense of crisis which is fairly widespread amongst the general population as well as amongst the political leadership. So I would expect to see much, much smaller gatherings moving forward. We have 2 phases of state elections left in the state of West Bengal. And so there are a few more days of campaigning still to take place, but I would be very surprised if we saw those numbers actually show up.